Cradle cap is a common skin condition that usually develops in the first few months after birth. However, it could affect your little one up into toddler age. Cradle cap usually affects the scalp, hence the name, but less commonly it also affects the face, armpits and groin. Cradle cap can look rather unpleasant, but it is usually not painful or itchy. Cradle cap usually clears up on its own in weeks or a few months. Cradle cap consists of thick, crusty, oily or scaly patches that appear on your newborn's scalp. It can also look like patches of greasy yellow crusts. Cradle cap can sometimes be accompanied by mild redness or a rash on the head, and it's easy to confuse with conditions such as eczema or even dandruff. Your GP can help confirm a diagnosis, but unlike eczema, cradle cap is not itchy or uncomfortable. Parents often assume that cradle cap is caused by poor hygiene or an allergy, but this is not true. Some experts say that cradle cap may be due to the production of too much oil in the oil glands and hair follicles, trapping dead skin cells. Remember that your baby is new to the world, and the condition is the likely result of your baby's body adjusting to its new environment. It is not contagious and cannot be caught from another baby. When cradle cap falls off on its own, hair loss can occur when hair stuck in the cradle cap falls off, but don't worry, your baby's hair will soon grow back. Because cradle cap can look quite unpleasant, the temptation is to pick the bits of skin off. It's best for your baby if you avoid this, as it can leave your little one looking red, sore, and can sometimes cause bleeding. Picking may also lead to sores, which can become infected. While it's very tempting to pick and scrape away little pieces of cradle cap yourself, try not to do this. If you have picked your baby's cradle cap off or the skin is broken, do not commence any treatment of the condition with a medicated shampoo, as this can cause discomfort and be irritating to any exposed skin. Using a medicated baby shampoo is a good way to help your baby get rid of cradle cap. You should speak to your pharmacist about which is best for your baby. However, not all parents are aware that you should first try the product on a small area of your baby's skin the day before you intend to use it. This is to check for any adverse reactions. Medicated shampoos should not be used if your baby has any redness, swelling, blistering, dryness, or cracking of the skin. Some babies are allergic to the ingredients used in medicated baby shampoos, and so care should be taken when using new products. By checking with your GP, you can be sure you're using the right products on your baby. If you use a product and you notice any signs of skin sensitivity or allergic reaction, stop using the product and seek medical advice. Cradle cap can be treated by applying oil such as olive oil or coconut oil to the scalp. Alternatively, apply a moisturiser such as emulsifying ointment or petroleum jelly. Make sure to avoid peanut oil and other nut oils in case of allergy. Gently rubbing the oil or moisturiser into the scalp can help loosen the cradle cap crusts and scales. Brushing your baby's hair with a soft baby brush and washing your baby's hair with medicated baby shampoo may also help. If you are at all concerned that your baby's cradle cap is not clearing up on its own, visit your GP or speak to your pharmacist, who will be able to advise the best course of treatment. When your little one has an ailment, it can make parents feel overwhelmed and upset, which can have a significant impact on mental health. Remember that you are not alone and there is plenty of advice out there to help. But if you are struggling, visit your GP or health visitor for more personal, tailored advice.